In this video, we will explain how to use the ECG. We will explain what it measures, how to connect the ECG probe, and how to make sure that you get proper measurements. The ECG can measure the patient's heart rate and respiration rate, and it will also show you the ECG and respiration rate waveform of the patient. To use it, you will need the ECG leads and 3 ECG dots. These dots need to stick to the patient's skin. Therefore, patients with damaged or very fragile skin might not be suitable for ECG. You can connect the probe to the monitor by plugging the probe in the port at the side of the monitor with the matching color. There is an arrow on the probe which has to be on the top. There is an image on the ECG lead which shows where to put the ECG dots on the patient. 2 need to be placed just below the collarbone, and 1 on the left side near the bottom of the rib cage. Before placing the ECG dots, the skin needs to be cleaned with alcohol to make sure that the dots stick properly and have good contact. Dots will not stick well on an oily or dirty skin. Wait a minute for the alcohol to dry and then place the dots. Make sure they are not on top of the nipples. When the dots stick to the skin, the grabbers can be connected to the dots. You have to make sure that you connect the right grabber to the right dot. An easy thing to remember: the green grass is below, with the yellow sun above, and the red bird flying away. When the ECG is connected to the patient, the vitals and waveforms become visible. The waveform could help to see if the vitals are measured properly. A good measurement has a regular waveform, with clearly visible peaks. If the waveforms look different, it could be an indication of the dots not being placed properly, or of grabbers being placed on the wrong dots. If the signal shows a lot of noise, with no clearly visible peaks or no regularity, it could be because of patient movement or because the ECG dot does not have a good connection to the skin. Make sure that the ECG dot is well connected and the patient is not moving too much. When removing the ECG lead, first remove the grabbers of the dots. Then remove and throw away the dots. Clean the grabbers to ensure that they are clean for the next patient.